Everyone. Thank you for joining us for this webinar on infection control and prevention. So it's practical guidance for early childhood professionals. My name is Wendy O'Kea and I'm the founder of TeachCloud, which is a management and compliance app for preschools. We have a number of resources that will accompany this webinar that will be sent to you by email next week. These include a link to purchase a certificate of attendance, the webinar recording, access to on-demand training on everything from guiding children's behaviour to loose parts, free ebooks, and a letter if you have a suspected case of COVID-19. So there's a lot of resources available to you, and they will be sent next week. Many of these are already available on the TeachCloud website and on our blog, and we have free training on the Cloud Academy website as well. So to get started on this webinar, it discusses what is new in the latest guidance for those working in Irish early childhood services. We will discuss everything from group sizes and ratios all the way to post-infection procedures and what tools you can use in early childhood services. You can also leave questions throughout the webinar in the Q&A box at the bottom of your screen. So I am delighted to be joined by Gillian Carrington, who is a seasoned regulatory and litigation lawyer. Gillian has almost 3 decades of experience in EU and public law. While Gillian is legally rigorous, she brings a pragmatic, problem-solving approach to guiding clients and articulates complex legal issues with clarity. And this is exactly what we need today and what we aim to do during this webinar. Bring a practical approach to the guidance on COVID-19 for those working with young children. So I'll now leave you with Gillian, who will discuss what is new in the latest guidance.
So 10 months ago, we were looking at schools going back for the first time, or preschools going back for the first time after the first big lockdown. And the guidance was at that stage not that prescriptive and not very regulation heavy, if you like. And it's changed. So this webinar will address the new guidance from HSE and HPSC that came out on the 24th of March. So it's brand new and current. And we, as I say, the 24th of March 2021 guidance, which has come out from HSE and HPSC. And I'm just going to give you a few highlights from where that has changed. So first and most importantly, in relation to the virus itself, about 10 months ago, they were saying, look, this is only spread by droplet and by contact. Now it is recognized and they're acknowledging that it is also spread by aerosols, that is to say, these tiny particles that build up, especially in indoor spaces. And what you will see in the new guidance is an emphasis on ventilation, as well as the other precautionary measures in relation to social distancing, cleaning, hand hygiene, nose hygiene, and so on. Also in the new guidance, we have, it allows for a little bit more flexibility with pod sizes and ratios, while requiring you to keep within the existing rules for ratios. But what it essentially means is that once you've hit the minimum ratio for adult to small child, then you have a little bit more flexibility in terms of structuring your pods. There's also new requirements in respect of attendance documentation, which is very important because that is going to be your record that you have complied. And there's also new guidance in respect of parent-toddler groups and for children with additional needs. I've just pulled out some of the highlights there because I can't talk about everything in the time we have available to us, but that is my short summary of what's new. Okay, so let's talk about coronavirus risk and small children. Now, small children are a particular risk for coronavirus because they can't be required to maintain social distancing. They seek contact with people and with their carers, with their teachers on a regular basis. And most importantly, they tend to put things in their mouths. So they do pose a particular risk. And the management of small children within the childcare environment for coronavirus restrictions is very important, because you have to approach it in a particular way that would not apply to older children. Okay, and here is my advice on how to approach the government's guidance. Now, in a way, the government's guidance is your best friend, because if you are following what the government currently says, then of course, you're likely to be able to demonstrate compliance. Having said that, we're dealing with a fluid situation. Things change all the time, and the guidance itself recognizes that and requires you to log into a number of sites to keep updated. So you approach the guidance as your friend, but it's guidance, so it's what we call guidelines, not tramlines. If you think that a particular situation, a real-time situation, requires more action on your part than the government guidance suggests, then you should always go with your common sense instinct, your gut instinct on that particular point. The guidance will only help you to a certain extent because it recognizes that the situation is fluid. And what I would advise is that you approach this guidance and you approach your real life situations from the point of view of the precautionary principle. The precautionary principle is effectively the fail-safe principle. So if, for example, you know that you're within a particular pod size ratio within the regulations, but you feel that nonetheless, given the situation on the ground in your childcare setting, requires pod sizes to be smaller, then you should always default to the fail-safe option. So you may have failed because, in one sense, because the pod is smaller than it needs to be, but you're failing safely at every point, as opposed to failing dangerously. And I would advise in this COVID situation, you approach all the government guidance with the precautionary principle. Now, the other thing that's very important is to keep logging in and keep updating. So I'm going to give you a couple of situations here where you are required to just log into the relevant websites, which will all be hyperlinked, by the way, in the documentation that follows this webinar. But for example, now it is recognized that COVID can be spread by aerosols, but the science seems to be in quite a rudimentary state. So in the new guidance, for example, they advise that you should not use air purifiers, humidifiers, defoggers, equipment like that to deal with the particle spread risk. But they might change that very, very quickly as they evaluate the state of the science of this technology and become more comfortable with it. So that's one example where you should log in more frequently, or as frequently as possible, to the guidance and see what the government's currently saying in that respect. Another situation is the emphasis in respect of or childcare givers wearing masks has changed from 10 months ago. 10 months ago, they were saying, well, we don't really think it's necessary. We don't think it's appropriate in a childcare situation. Now it's moved to, well, we think it's highly advisable. And when you see a shift like that within the guidance coming from the government, you know that it's very possible at any point that they will suddenly say the wearing of masks by caregivers is compulsory in all situations. So just two examples of why you should keep yourself up to date in respect of what the government is currently advising.
Yeah, so as Gillian mentioned, frequency updates is incredibly important. And for example, on TeachCloud, we have policies and parental declarations via the enrollment form that can be shared with parents. And parents can also view and download any policies and sign them using the Free Parent app without having to physically visit the preschool. So we know that the guidance and some of the regulations are changing. Sometimes it feels like they're changing on a daily basis. And so being able to communicate with your staff, but also with your parents on any of these changes, as Gillian mentioned, is extremely important.
Okay, so coming on to the guidance itself, it has certain elements, some of which you will be very, very familiar with, which you should observe at all times. First of all, there is the stay-at-home principle whenever there's anything that is remotely symptomatic of a respiratory infection. Now that goes for not just the children, but also the caregivers themselves and the parents. And what you will see in the new guidance is a lot more, it's not a requirement, but it's certainly a very strong nudge that parents should be required to provide wellness declarations. So if the child has been absent, or if there has been an incidence of COVID, or if there has been an instance of a respiratory disease at home, then they are advising that you should get a wellness declaration from the parents that the child or the parent themselves is safe to attend the school. And that also goes for caregivers. Then, as I mentioned earlier, we have the increased emphasis on mask wearing, whereas previously it was said not advisable in an early childcare situation. Now they're tending to say you should tend to wear masks when with the children. Hand sanitizers you will be very familiar with. That's been a regulation for some time. On the surgical gloves side, or on gloves in general, what you will see in the new guidance is new requirements as to cleaning routines, and they've split it up between a normal cleaning routine, which is designed to prevent the spread of COVID, and the post-COVID cleaning routines. And you will see there, for example, the requirement for gloves, and then I think we've done face masks, and then of course hand sanitizers and nasal hygiene, if you like. So these are some of the elements of the prevention strategy, or indeed the post-COVID strategy for early childcare situations. Now, the previous guidance and the current guidance tends to look upon prevention as a better strategy than cure. And one very important plank of the prevention side of things is trying to keep the school as much a sealed unit as possible. So when I say sealed unit, I don't mean sealed to the outdoor air, because again, here the guidance has changed. They're recommending being outside as much as possible. They're recommending ventilation through the opening of doors and windows as much as possible. But where parents come into the childcare situation, preferably by appointment unless absolutely unavoidable, there are routines for dropping off and picking up children, so that effectively the child is brought into the school or the childcare setting by a caregiver rather than a parent. They've now introduced contactless drop-off points for objects, for example, that have been forgotten. And all this is aimed at keeping the school as much a sealed unit as possible. And from your point of view, it's also aimed at making sure that you have documentation of who was where and when, and what the contact points are with the outside world. So pods, daily attendance at pods, they're now recommending that this is documented, and it's also saying that it should be documented every day, who was in the pod at any particular point. And also they're recommending the documentation of parent-toddler groups, including as well a wellness declaration from the parents. Now we're incorporating guidance which has always been there, which is the risk assessment side of things. This guidance only ever supplements existing risk assessment requirements from HSE, HPSC, TUSLA, whoever it is. And you are required, and you will be familiar with doing a risk assessment, documenting it, planning how you're going to implement it, and training your caregivers as to how the risk assessment will be put into practice for your policies and procedures. And here we have from HSE how they recommend you carry out the risk assessment and implement your policies and procedures for COVID-19. So it's all to do with communication and consultation between the school governance and caregivers, between school governance and parents. You must require that people read and sign your policies and that they're displayed. You identify the people responsible for performing certain tasks. You fill out all the employer information, and you use the government checklist to help you plan your response. And here something like the Teach Cloud app will be very helpful, for example. And you have a COVID-19 response plan for the worst case scenario.
Yeah, so as Gillian mentioned there, assessing the risk, identifying hazards and putting in plans place to mitigate these risks is especially important during COVID-19. But as early childhood professionals, we're used to doing this. To support this important task, TeachCloud supports practitioners in doing risk assessments in one step, with the ability to sign assessments online, download them and share them with parents as well.
So as part of your implementation of your risk, your COVID policy, you will want to raise awareness of COVID, how it may be transmitted, communicate with the parents and warn. And of those three requirements, I would say communicate is the really essential plank in the COVID-19 strategy. If you can communicate with parents, if you can communicate with caregivers, then if you can communicate, for example, with third-party providers who have to come on site, say, you know, an emergency plumber or somebody who is helping a child with additional needs, then you are 70% of the way there to having an effective COVID strategy. Now, also the government is advising and has provided helpful posters which will allow you to communicate what your policy is and what you require people to do very easily.
Yeah, so we know how important digital communication is, especially when working with very young children. So you might use notes going home, you might use emails or an app like TeachCloud, which enables you to share images, videos and documents using the instant messenger, and especially to maintain that social distancing.
Okay, so let's look at some of the difficulties or some of the points that you have to address in your COVID prevention strategy or in your COVID recovery strategy. And again, all reflected in the guidance. Now, what we have here is a classic infection transmission point in this picture. You have a very young child who is likely not to be likely to put things in her mouth, likely to touch things. You have a door handle, you have a very narrow entrance and exit point, which is the doorway itself. And the guidance deals with precisely that. So, for example, when it comes to meal times, either you should arrange for food to be brought to the classroom where the pod is, or if you have a canteen, then you're going to be looking at several things in relation to a problem such as the one in the picture here. You're going to be wanting to have a very regular cleaning routine, which is documented in accordance with the guidance, which is now very prescriptive on cleaning routines. But you're also going to want to be staggering meal times so that you don't have a constant flow of children and adults from different pods who could potentially pass on disease between them. So you're staggering meal times, for example. And on top of that, now they haven't made it a requirement yet, but there is a very strong push to ventilate. So ventilate indoor spaces by opening windows and by opening doors. They say in relation to ventilation so far as compatible with comfort and security. So, I mean, in North Europe here, where we tend to freeze during the winter a little bit, obviously, you know, it's not particularly desirable that a classroom is freezing for the duration of a lesson, but nonetheless, ventilation is very important. 10 months ago, the rule was it's as per existing regulations. So, for example, for less than 1 year, it's 1 to 3. For 1 year, it's 1 to 5. For 2 years old, it's 1 to 6, and so on. What they've now said, because the problem with that policy they had previously was you could actually have a massive pod. I mean, you know, there was no upper limit on pod size. And what they've now said is, okay, you have to comply with existing ratios, existing regulations, so they don't change. But where you get discretion is if you want to keep your pods tiny, if you want to keep them, say, to, I don't know, 6 people, you can do that. So although they say there is no maximum pod size, they're pushing you towards exercising your discretion to keep pods as small as possible. And as I said earlier, pods need to be documented now. Daily attendance, you know, who was there, what the pod size was, you know, has to be documented on a daily basis now.
Yeah, so that's very important. And I think, again, in early childhood services, we would always have been documenting attendance for inspection purposes. And on TeachCloud, we've enabled the ability to do that. So you can track children's attendance, you can request an absent reason from the parents as well, and parents can also upload any documentation that is needed. We're going to also be implementing the ability to track staff attendance to further support your documentation of ratios. And again, trying to keep those pod sizes as small as possible where reasonable.
So there's quite a lot of very detailed guidance on taking these icons one by one. First of all, hand washing after using, for example, after using food or assisting somebody with toileting needs. This is all set out in the guidance. And on top of that, they also deal with disinfection of hands. And obviously, between June last year and now, somebody has tried to drink disinfectant. So there's now additional requirements about keeping it in a way that means that children can't actually put it in their mouths. There's guidance on social distancing, which is 2 meters wherever possible, while recognizing that with very small children in a childcare setting, you cannot socially distance. So the 2 meters applies to the older children, it applies to adults coming into the school, it applies to inter-adult interaction within the school or childcare setting, but they do recognize that social distancing in young children is not viable. There's a general warning not to touch eyes, nose, and mouth, or as little as possible. And that applies whether you're wearing gloves or not. Gloves are not going to stop the spread of infection if you're touching eyes, nose, and mouth. And then there is detailed guidance on keeping objects and surfaces clean. So as I say, the cleaning requirements have now been enhanced, and they've also been put in a table form in the new guidance. And I would advise you to take that table and to add an additional column so that you can document your cleaning routines. And they've now split up cleaning advice between COVID prevention, i.e. where you don't have an outbreak, and post-COVID procedures. So the cleaning requirements differ. And the main difference is the use of disinfectant and sodium hypochlorite, which they are recommending as a post-COVID measure, but not necessarily as a pre-COVID measure, unless it's something like a toilet and so on. And they've also now begun to set out the order in which rooms and objects should be cleaned. So, for example, you start with the least, I mean, a lot of it's common sense, but it's now in guidance. You start with the least dirty first, and you end up with the most dirty. You clean from top to bottom. All this is now in the guidance. And obviously with some things like toilet facilities, hand washing facilities, there is particular guidance around those spaces. And the documentation of cleaning is going to, in my view, become extremely important for you. You may even have separate requirements from your insurers as to documentation. But as I say, where the government has now got as specific as a table, then I think it's very much in your interest to go with the government guidance and to document your cleaning routines on a daily basis as much as possible. And obviously the advice as to cleaning also takes into account the safety of the cleaning staff themselves. So they've also now moved on to the type of equipment that cleaning staff should be provided with.
Yeah, so just even talking about the cleaning sheets and them being extremely important. Of course, we've always done them in early childhood services. So on Teach Clyde, we've also enabled the ability to document and create your own cleaning sheets, again, based on the government guidance, as well as sign those documentation and have them there for printing or download, or even for other teachers or management to view when needed.
Yes, and now we come on to the difficult question of learning materials. So these are very obviously potential infection vectors. So there is a lot of guidance about keeping learning materials, objects that the children use on a regular basis, such as jigsaws, within pods, not sharing them between pods. And there is also a lot of guidance now on how particular objects should be cleaned and how often certain things should be changed. So I always get asked about Play-Doh, and the government is now advising Play-Doh should be changed daily. And then in respect of outdoor sandboxes, what the government is currently saying is that they don't see these as a particular risk. And especially if it's outdoors, they think it's unlikely that COVID could be transmitted by different pods, for example, using the same sandbox. So they're not saying change the sand daily, but they're saying you have to be aware of it, and obviously if a particular risk presents itself in relation to a sandbox, then you're back to your precautionary principle. And even though the government doesn't require you to change it, if you think it should be changed, the sand should be changed, then you should change it. And then we have certain guidance in relation to cleaning electronic learning materials. So these are tablets, surfaces which people touch a lot, especially if they maybe touch their nose, maybe touch their mouth, and then they touch a tablet. And there's guidance on that. These obviously should not be cleaned with disinfectants, but in accordance with the manufacturer's instructions. Each pod should have its own box of toys, learning materials, other objects, which should be cleaned in a certain way. And even if they're not being used on a daily basis, then toys or learning materials that are not being used should certainly be cleaned on a weekly basis. And there are certain recommendations in relation to using brushes, for example, to get into crevices. So what you need to know is quite extensively dealt with in the government guidance. It differs according to what the object is, but nonetheless, these will have to be cleaned because they are obvious infection vectors. Now, we come to the implementation of the COVID response plan, and I just want to mention a couple of new factors in the guidance here. First of all, in relation to testing, the Irish government is not recommending testing as mandatory in schools currently. What they say is the test will only be good for a day or so anyway, and we don't think it's necessary to test on a mandatory basis. They're also saying that where a child comes back to school after an absence or after an illness, whether COVID or not necessary to get this approved, to get a doctor's certificate saying the child it can come back into a setting where it will encounter other children or teachers. That's not necessary. They're not recommending temperature testing on site, but where you do test for temperatures, what they say is if the child has a temperature of 38 degrees Celsius or higher, obviously, don't just put this down to, and you think it might be teething, don't rely on it being a teething issue. So basically, if the child is demonstrating symptoms that are similar to teething, I think what the government is saying is it may nonetheless be COVID. You can't rely on your assessment that it is teething. So if you happen to notice that a child is demonstrating flushed cheeks, whatever it is, this is now something that you have to take as a warning signal. And then, of course, you will have been required to have a COVID response plan, and you will be required to implement it. And now the government has again broken up its advice for COVID prevention and what happens after a COVID response plan. What you should do then differs significantly. So in terms of post-infection procedure, the basic situation that HSE takes over once you have a confirmed outbreak of COVID within your childcare setting hasn't changed. So they will then step in and they will contact trace people, and they're going to rely on those attendance records. The government now says that explicitly, in order to trace close contacts of people. Then the cleaning advice is very different for a post-infection procedure. You have to isolate so far as possible. You have to make sure that certain facilities such as toilets or common eating facilities are safe for those who are actually using them post-infection. You are disposing of waste differently post-infection. So, for example, in the normal run of things, you will dispose of the waste that you generate during the day in the normal waste stream, if you like. Where it's post-COVID, the waste itself has to be isolated for 72 hours before it can be collected by anyone. And then importantly, on the infection procedure side, you are effectively cleaning with quite high-grade disinfectants and sodium hypochlorite as opposed to normal detergents.
Thank you for joining us on our webinar on infection and control. You can download many of the resources spoken about in this webinar on teachcloud.com. Here, you can book a demo for our early years and preschool management software or contact us. You can also use the blog section to download many of our free resources. Here, we have draft letters for parents, free ebooks on diversity and equality, guiding children's behaviour, and much more. You can also access free and paid training courses on Cloud Academy. These include everything from guiding children's behaviour, food safety awareness, diversity and equality, to homeschooling and preschool educational activities and learning opportunities. These learning opportunities range from STEM, loose parts, all the way to songs and magic tricks for children within the home and preschool learning environment. If you have any questions, email us hello@teachcloud.com.